Thank you, Madam Chair.
Okay, Senator West. And Senator, before you begin, I want to acknowledge another non-committee member that we welcome, Senator Lucio. Senator West.
And this may very well just be a question for Mrs. Cooper, for the resource.
Okay, Ms. Cooper. Go ahead, Senator.
One of the issues that Dr. Lowe was talking about is the underreporting of complications with medical abortions. I know there's an annual report that's required. Is that issue included in the annual report?
Well, actually, we have three means of reporting in terms of complications. One is, as you mentioned, the annual reporting, and there's a variety of data points that are included, which are the type of complication. We also now, as of January 1st, 2013, have complication reporting where anytime there's a known complication, a report has to be submitted to the department within 30 days of knowledge of that.
So if someone would say that there is no statistical evidence of complications in the state of Texas, the agency responsible for regulating this particular licensed abortion facility collects that information. Is that correct?
We do.
And the only thing you have to do is go to the website to find that out?
A lot of the data is reported on the website as far as the annual reports, and currently the data, the full extent of the data is available through 2011
so we have,
on the website.
We have data available through 2011 that talks about, gives information on complications as relates to abortions.
I believe it does. I know that's part of what's collected. Dr. Becker would be able to speak to the data in terms of what the Center for Health Statistics compiles and what data is available, because that's her expertise.
And is Dr. Becker here?
Yes, sir, she is.
May I call Dr. Becker?
Dr. Becker? She is one of our invited registered resource witnesses. Dr. Becker, would you identify yourself, please, for the record?
Yes, Madam Chair. I'm Dr. Marcia Becker. I'm with the Center for Health Statistics, which is part of the Department of State Health Services.
Dr. Becker, there's been testimony here that in the state of Texas that has been underreporting of complications associated with, I think, medical abortions. Okay, and may have the medical abortion term wrong, but there's underreporting in the state of Texas. The state of Texas, through the agency that you currently work for, collect information on abortions.
Yes, we certainly do, and we do an annual report.
And in doing that annual report, do you collect information on complications?
The complications were added to the abortion reporting form.
So you do collect it?
And yes, we do collect it.
Right.
It's relatively new, though.
When you say relatively new, how new is it?
It started in January for collecting the actual complications on the form.
What does that mean?
Well, what it means is the abortion reporting form was amended with the last legislative session, and new questions were added concerning complications during abortions. And that for 2012, the data is just being summarized and starting to be analyzed at this time, but it is not fully available.
Prior to 2012, then, was there any regulation that required reporting of quote-unquote whether or not there was a complication? Not the specific listen to the question. Not the specific complication, but whether there was a complication.
Yes, a complication form was available.
And when did we start collecting that information?
The complication form, I think that was with the 2011, I believe, data.
So prior to 2011, we didn't have any data as relates to quote-unquote the generic term complication? Requiring a report on quote-unquote whether there was a complication, not the specific type of complication, but whether there was a complication.
I guess what I'm thinking about is the specific type of complication.
So I'm not talking about the specific type, because I know that that's when that occurred. But prior to that, there was in fact a category there was in fact a requirement to report whether there was a complication.
Yes, I
Okay.
believe so.
And that goes back some years now.
Yes.
And so one would only have to look for that information or request that information to make a determination that underreporting of complications is not a problem, that was not a problem in the state of Texas. Would you agree?
I agree.
Now, let me go back to Dr. Love. Dr. Love, you are OBGYN.
That's correct.
Now, did you, when we first came up with these licensed abortion, when the state first authorized licensed abortion facilities, were you in the practice at that time?
When was that?
I don't know. When did we come up with it?
1999.
1999.
Yes.
Okay. Did you have an interest in this area, that is the abortion area, at that point in time?
Yes, I've had an interest in it.
Okay. Did you participate? When the law was passed, did you participate in having input into the regulations that would be promulgated to kind of govern or regulate licensed abortion facilities?
No, I did not.
Okay. You did have, if you wanted to, you probably could have. You probably just didn't know, like most of
I
us.
was probably busy delivering babies.
Okay, probably. Okay, all right. So, do you have any problems with the regulations that have been promulgated by the state to govern licensed abortion facilities? If so, what are those problems?
You know, I'm not saying I have problems. What you were referring to, I guess, let me take this moment to address that, about complications.
No, I didn't ask you about complications. I asked you, do you have any problems with the current regulations?
I'd have to read over those.
Have you read the regulations?
Not the current regulations in specific detail, no.
Okay, so you don't know.
I would be happy to read those and get back with you if you have a copy of those.
Okay, but you are here saying that having an ambulatory surgical center would be far better than just leaving it to a licensed abortion facility.
Yes.
But you have not read what's required for licensed abortion facilities to make the comparison, to come up with that.
What I said was I've not specifically read every detail of that. You know, I've read different issues of it, but I can't say I've read every word.
So let me ask you this question. So you believe that the need for male and female locker rooms is important to having for the safety and health and safety of women?
Not necessarily. I think that's kind of detracting from the issue, though.
Do you believe that having janitor closets is important for the health and safety?
Actually, I do. I think it's really important to keep dangerous chemicals away from people who don't know how to act in public.
They don't know how to do what?
Act properly in public.
Okay. But you have not read what the requirements are for
I mean, that's the reason why we
Sir,
do that in our office.
can I finish the question?
You may.
But you have not done a comparison between what the current requirements are for a licensed abortion facility and an ambulatory surgical center to determine whether one is better than the other, right?
Not head to head like y'all have been given.
All right, thank you.
Senator Dewell?
Dr. Becker, thanks for being here. Complications of abortions, how are they reported?
Now we have more than one way, actually probably three, when you consider what Ellen was discussing as well. We have an abortion complication reporting form, which is a one-page form.
Who fills that out?
The physician, the facility
perform the abortion?
The facility where the abortion was performed actually has the duty to fill that out and report that to us.
If another physician unrelated to the abortion clinic takes care of a woman who has a complication of abortion, is he or she required to report that complication?
Yes, they are encouraged. They should get with the facility where the abortion was performed and have them complete that form as well.
So the physician, if Dr. Love or I take care of a woman who has had a complication for an abortion, we're supposed to contact the facility that did the abortion. And
they are encouraged to, yes.
Are we required to fill out a form and send it in?
To my knowledge, I'm not aware if that's required for the physician who finds like a patient in the ED,
Okay.
ER.
All right, go on. You said that's one way. Let's go on with the other.
Oh, okay. We also have our annual reporting for all abortions, and it now has a section on it where it discusses different complications that may have arisen, and they can fill out the different types of complications that occurred. And also, as Ellen was stating, the facilities are also supposed to report in, I believe it's within a month, she said within the first month or first 2 weeks, if anything did occur.
Now, you're in charge of all the statistics,
We handle
not just this.
Right.
Right, okay.
The births, deaths, fetal deaths, and whatever.
But like sexually transmitted diseases, do you handle that too?
Well, that's actually in the HIV and STD area.
Okay, but there's lots of things that physicians are supposed to report.
Exactly.
Do you think, you know the percent of compliance with that? Do you have any idea?
It varies greatly. My background is in epidemiology, which many of the epidemiologists cover the different disease registries. And so there's different disease registries like for STDs, for HIV, for heart disease, for birth defects, for injuries, and the compliance rate, varies with each of the different registries.
Do you know how much it varies in just range, ballpark?
Oh, there's some that have stricter regulations with them, and they would have better compliance, and probably upwards of 90 to 95% compliance, and others that don't have penalties involved, like injury reporting, it's probably far less compliance. 50%.
Senator Taylor?
Madam Chair, thank you. Dr. Love, did you have further clarification you want to do on your underreporting of complications?
Well, I'd like to say that, when you look at this particular study that showed a higher complication rate, they actually had an abortion registry where everyone who chose to have an abortion was registered. It didn't rely on patient reporting. Patients are not always up front when they tell you what procedure's been done, what's been done. Sometimes they will not tell you where it was done, or even if they've had a medical abortion. Sometimes they just show up bleeding and you take care of them. This study here basically cross-referenced everyone who was registered in the abortion registry with hospital admissions or emergency room admissions. And that's how they were able to come up with it. It did not rely on patient reporting or clinic reporting. And so it kind of takes that particular aspect out. It looks only at admissions to the ED and the hospital compared with the abortion registry. And in a small country that has a pretty much homogeneous population, it gives you a better idea of what really occurs than when you rely on self-reporting. I mean, there was a study that came out in January 13 in ACOG where Cleveland was the author, and they talked about complication rates. But they also addressed the fact that self-reporting administrative errors can change the actual facts of that. And we can get you a copy of that study if you'd like to compare it.
So just clarifying, you were talking about underreporting by actually the patients.
The patients and the clinic, and relying on administrative staff as opposed to being able to go in and look at a cross-reference.
Thank you, Dr. Love.
Senator Campbell, was that a light, Senator Campbell? Okay, Senator Campbell.
Thank you, Dr. Love. Even before I get to Dr. Love, Ms. Becker, do y'all use the same evaluation form for abortion facilities as you do ambulatory surgery centers when you go through and do surveys?
No, we actually, the abortion data is basically it's a standalone data registry, if you would. It is strictly abortion data that comes in and is entered into a database.
I'm talking about whenever you actually go do an inspection as compared to an inspection in an ambulatory surgery facility. Do you use the exact same form?
I would doubt it highly, but that would be Amy's.
No, I'd rather have
that would be Ellen's purview as far as inspection.
I'd like to ask that real quickly to Ellen.
Any members? I appreciate all the questions, but I would remind you that there are lots of people from the public arena that came to testify, and we need to wrap up this down. Go ahead, Senator Campbell.
Do you use the exact same form when you are comparing? We've talked a lot about comparing facilities. Do you use the exact same form when you do a survey?
Actually, for each rule set, which ASCs have theirs, and
so they're different.
They're two different rule sets, and so there's a list.
That's just what I need, because I feel like we've had a lot of talk about the facilities trying to make them look alike. just common sense to me, I think I would expect less deficiencies to be found in a facility where there are less standards to compare to and check off, as compared to a facility where it's highly regulated, the standards are higher, then there are more things to check off, or deficiencies, if you will. So I was just, trying to compare, while it's all related to women's health and the safety there, if the standards of a facility you are surveying are less, there's less things to check off, compared to if there's higher standards in another facility, there's going to be more things to find deficits for. Would you agree with that?
It's really depending on the facility type. The regulations are different for each one. However, again, it's kind of apples to oranges. I can't say that there are more or less requirements for one than another.
And I'm going to just close with this, but my comment is, when one facility is inspected and has numerous standards they have to meet, I would expect the opportunity to have more deficits, especially since there are more of them across the state, than if you have less regulations and less standards to check off. Thank you very much. That's all I have, Madam Chair.
Thank you. Thank you to this panel. We all appreciate your being here.
Can I address some of the...
No, ma'am.
Okay.
Thank you to this panel. We are now going to take up public testimony.
Madam Chair.
Who was that? Yes.
One question. I've been advised that there's still confusion in the lines about what the procedure is to turn in the written testimony if they weren't here in time to sign up to speak as a witness. It might be worth repeating to make sure everyone's clear on
I'd be
what our
happy
process is.